and welcome to the Evidence-Based Chiropractor. I am your host, Dr. Jeff Langmaid. This week we are talking about spinal stenosis, and probably in a way that you have not heard before. There was a brand new paper that came out from the JAMA Open Network, Journal of American Medical Association, and it looked at chiropractors doing adjustments, and the results are what you are going to want to stick around for sure. Additionally, we have a few super early bird tickets left for the first Evidence-Based Chiropractor Live Intensive Weekend. It's happening June 7th through 9th. Short story on it. I have taken everything that I have learned marketing as a sole proprietor, as an associate, as a clinic director in a group that spent $5 million plus per month on advertising, and all of the seminars that I've went to, I've distilled it down to practical information that you can utilize to grow your business. We're going to shoot video together. We are going to write emails together. You are going to have the stuff you need to get out there in your community and to market your practice, all with an evidence-based, evidence-informed idea and concept behind it. So if that is interesting to you, if you have liked what has been going on with me at the Evidence-Based Chiropractor, I'd invite you to pick up a super early bird ticket. There are just a couple left, June 7th through 9th here in Tampa, the evidencebasedchiropractor.com/events. Again, that is the evidencebasedchiropractor.com/events. But today it is all about spinal stenosis. We are taking a look at an article that came out in 2019. This is brand new. It is called Comparative Clinical Effectiveness of Non-Surgical Treatment Methods in Patients with Lumbar Spinal Stenosis, Physical Medicine and Rehabilitation. That is part of the JAMA Open Network, and this just came out. So we know lumbar spinal stenosis, whether it's central canal or lateral recess for that matter, it's the number one reason that adults have spine surgery. And while the research supporting this aggressive treatment, quite frankly, is not very strong in the absence of red flags, there really hasn't been great evidence. There's been a big evidence gap in our understanding of non-surgical options, in my opinion, until now. So this is a randomized clinical trial that evaluated hundreds of patients dealing with lumbar stenosis. And like we see in practice, they were dealing with pain, right? They were dealing with the inability to walk any substantial distances, and they have significant decreases in quality of life, which ultimately is what drive people to search for answers and search for treatment. So this research paper found improvement in both the Swiss Spinal Stenosis Questionnaire and the self-paced walking test for patients who experience manual therapy as part of their treatment program. And that include mobilization adjustments by chiropractors. And similar to the researchers, I know all of us, probably you listening, have found mobilization, stretching, spinal stabilization exercises very, very effective, even though you probably aren't receiving the overwhelming amount of referrals you should based upon the efficacy of what you do. So let's take a look at a couple quotes from this paper, then we'll dive into some concepts regarding it. So the researchers found, quote, lumbar spinal stenosis accounts for the fastest growth in lumbar surgery in older adults in the United States. The rate of complex fusion procedures for this condition has increased by 137% between 1998 and 2008. Let me just repeat that one more time. The rate of complex fusion procedures for this condition has increased by over 137% in a 10-year span that ended not too long ago. Is that because there was an overwhelming amount of research showing that that was the best thing to do? Absolutely not, but it has occurred anyway. They also found mounting concern about the rising rates of spine surgery and opioid use in older adults makes a compelling case for the dissemination of new evidence about safe and effective non-surgical and non-opioid pharmacological treatment options for lumbar stenosis. They're saying, hey, this might not be the right thing. And now is the time to start looking for what can we do that's non-surgical? What can we do conservative? What can we do that doesn't rely on opioids? And timing's right. They also found, quote, it appears that the chiropractic/physical therapy intervention had better short-term outcomes at 2 months. So what did they find? Well, when we break things down, they were looking for a 30% improvement. Greater than 30% improvement is really where they kind of said, hey, that's clinically significant. That's going to impact somebody's life. And what they found was, quite frankly, manual therapy, which is the chiropractic group, outperformed the rest. So when they looked at that Swiss spinal stenosis questionnaire, roughly, 30% of the individuals reported being 30% better if they received manual therapy, where it was only maybe 8% reported 30% improvement or more if they were under what we'll call the medical care group. Additionally, that self-paced walking test, this is probably one of the most pragmatic items here. It's literally, how far are you walking, right? I mean, that's the quality of life that's really the lack of being able to ambulate is what drive people to surgery. So I can't overstate how important the self-paced walking test is. And what they found was nearly 70% of the individuals who received the conservative care, manual therapy, chiropractic mobilization, nearly 70% of those individuals had a 30% or greater improvement. Whereas, just a little bit over half of that, maybe 35 to 40%, had received 30% improvement if they were in the medical care group. There's a lot of percentages there. But the bottom line was manual therapy, mobilization, stretching, exercise outperformed the medical care group and the group exercise group as well. Group exercise was just, hey, go and work out with a non-specific trainer, let's say, for an hour a couple times a week. So that was the third group there. There was a medical care group, which was basically medication and or injections. There was a group that was group exercise, which was what I'll call non-professional or non-healthcare professional. And then there was manual therapy, which was mobilization, kind of the chiropractic physical therapy, mobilization, exercise, spinal strengthening, etc. So clearly what the researchers found is probably what we would expect, but many people don't know. Hey, the most benefit, the percentage of individuals who had the most benefit resided in the manual therapy group. Now, one interesting thing that they brought up in this paper was that when they looked at about 6 months down the road, everybody had some improvement, but it was not really, it didn't lean heavily one way or the other. Now, that gets to be really interesting because when we start to look and say, okay, well, 6 months down the road, everybody had some improvement. Okay, so that's really interesting. Every group, right? Each individual might have had some ebb and flow. But the groups universally did a little bit better as time went on. So that means, as they point out in the study, that with spinal stenosis, there can be an ebb and flow of the symptomatology. It's not always linearly downhill. So to me, that means in the absence of red flags, no individual should be jumping into a surgical solution because we find pretty much no matter what they do, they're going to see some improvement. Now, they can push that pace of improvement or that degree of improvement up. In my opinion, that could be with mobilization, flexion, distraction technique, exercise, all of those wonderful things. Or they could slow that process down by probably not doing anything. So there are different things that each individual within the group, different choices they can make regarding their care, treatment, and daily activities that can either push the accelerator or push the brake of their progression of their disease. But what that means in totality, again, is when there is an ebb and flow with the symptoms, that unless there are red flags, there is really no need to jump into a surgical solution. And we've seen that tickled, what I'll say, in some other papers before where surgical intervention and non-surgical intervention, kind of were equitable, at a certain point down the road. In other words, the individual with surgery didn't do crazy better than the individuals who didn't have surgery for this. And that's a really important thing. I don't know, I've looked at some other stats where, we're well above 500,000 fusions being performed in the U.S. each and every year. 500,000 fusions being performed is probably tracking towards 750,000 now. And in this study, they cite that 137% increase in a 10-year period in complex fusion. And spinal stenosis is the number one reason why people are having those surgeries. This is a very, very important thing to keep in mind as you bridge the gap and reach out with other healthcare professionals in the New York community. Now, quite frankly, I believe that surgeons are out there doing the best job they can, but it's probably not going to be a surgeon who all of a sudden starts referring out every single patient and essentially stops doing surgery except for red flags. That's just not going to be realistic. But when we look farther upstream towards our pain management doctors, our interventional spinal physicians, and absolutely the primary care physicians, These are exactly the items, the topics that you need to bring up to those other healthcare providers in your community. So as you can imagine, we're featuring this research update, this research brief for all members of the Evidence-Based Chiropractor because of how powerful it is. This is exactly the type of conversation that you want to have with the other healthcare providers in your community. You need to do it consistently, once a month. You need to get out there and reach out. You need to be educational, entertaining, informative. Doesn't necessarily mean you need to be unbelievably charismatic, but you need to have a system and process in place that enables you to achieve the results you desire. And if that's something you're interested in, of course, I'd always recommend check out our membership at theevidencebasedchiropractor.com. No one has done a better job for as long building relationships with other healthcare providers in your community. We have guided hundreds of chiropractors towards that process and helped you get the result you desire. More influence, ultimately more referrals into your practice, and a better, healthier community. People that are making better choices and informed of better choices by their healthcare providers. So that is on today's episode. It was all spinal stenosis. You have any questions regarding that paper, shoot me an email, jeff@theevidencebasedchiropractor.com. I'll also put a link in the show notes so you can check out the paper itself. And if you want to step up your marketing, I want to help you. So check out Adjust Your Marketing. It is happening June 7th through 9th here in Tampa, Florida. theevidencebasedchiropractor.com/events. I hope you have a great week in practice, and I will talk to you soon.
We appreciate you joining us for this episode of The Evidence-Based Chiropractor. Learn more tips for explosive practice development at theevidencebasedchiropractor.com. You can also join the Premier MD monthly membership, enabling you to use what you just heard to maximize results in your office.